There's a critical moment when a life is saved. It's when the right care is provided right now. It's not easy, but it's worth it. The Journal of the American Medical Association recently reported that more than 160,000 lives could be saved in the United States alone when care is provided by a multi-professional, integrated team of dedicated experts led by an intensivist. If your ICU aspires to achieve maximum benefits to the patient, the provider, and the hospital, let us show you how with Right Care right now. What does Right Care right now mean? Right Care right now means the right care is delivered at exactly the right moment, in time to achieve optimal patient outcomes. The rapid pace of the ICU demands critical thinking, communication, coordination, and assessment by an integrated team of dedicated experts, led by an intensivist, a physician trained in critical care medicine. Studies have shown that a 30% reduction in length of stay and over $6.5 million in hospital annual savings derive from adopting Right Care right now.
The team approach allows us to provide the best possible care. The Society is the only professional organization committed exclusively to both critical care and this multi-professional team concept.
What does it take to deliver Right Care right now? First, it takes integration. An integrated team of critical care professionals working closely together as a single cohesive group to achieve optimal patient outcomes, including critical care nurses, intensivists, nurse practitioners, pharmacists, physician assistants, physician specialists, primary care physicians, respiratory therapists, other professionals, and patients and their families. Team members are dedicated and have no higher obligations than providing the best critical care. During their service, the team focuses exclusively on care of the critically ill and on managing and improving critical care delivery systems. This is achieved not only through direct care delivery, but also by assessing their patients' outcomes and improving care delivery methods. Members of the team are experts because they are educated, certified, and experienced in providing care for the critically ill and injured. Each specialist brings his or her own unique expertise to the team and to the care of the patient.
I appreciate the benefits of working in a multi-professional team environment and am committed to improving healthcare delivery systems for the betterment of my patients.
The mantra of a patient-centered team is learn it, deliver it, measure it, improve it. The following principles are the foundation of the Society's strategic plan. All SCCM programs are developed around a continuing process improvement paradigm to support members in optimizing care. Learn it. Learn side by side with other members of the multi-professional team by participating in continuing education programs. Share what you've learned with your colleagues. Deliver it. Provide patient-oriented care competently and compassionately by focusing on both the delivery of service to patients as well as management of the ICU or other acute care settings. Measure it. Know how your team is performing by collecting data. Gauge your performance to your own history as well as to peers. Improve it. Develop and implement care improvement programs. Deploy safety tools that have a positive impact on patient outcomes. This process cycles repeatedly until your critical care delivery system provides the best possible and highly reliable care, even under the most difficult circumstances.
Being a member of the Society allows me to network with professionals and learn side by side with all members of the critical care team during Society programs. I find this both beneficial and rewarding.
Why is Right Care right now valuable to you? Understandably, you are your patient's best advocate for providing safe, quality care. Your patients look to you for the best possible health care, but also for education, guidance, and emotional support. This is what Right Care right now is all about. Make the Right Care Right Now commitment to learn it, deliver it, measure it, improve it.
Because of the Society's size and standing, it is highly regarded throughout the profession as well as in industry, and can therefore influence the direction of patient care, practice standards, and requirements from industry. SCCM brings together critical care professionals globally and provides one strong, multifaceted voice.
How can you provide right care right now to your patients? Start by taking part in high-level clinical education programs, learning side by side with your cadre of critical care experts in a team setting. Stay up to date with the latest research by reviewing journals such as Critical Care Medicine and Pediatric Critical Care Medicine. Take action to be sure your institution delivers the level of care you would want and expect for your family and yourself. Start small, think big. Even small changes in care delivery systems can make a large difference. Deliver quality care. Record the outcomes your ICU provides. And commit to making the necessary changes to provide the right care right now. Quite simply, right care right now means the right care is delivered at exactly the right moment in time to achieve optimal patient outcomes. The mission of the Society of Critical Care Medicine is to secure the highest quality care for all critically ill and injured patients. The Society's integrated team approach is highly regarded by government agencies, the public, and notable institutions, making the SCCM the primary advocate for critically ill and injured patients and their families, as well as being the definitive authority on critical care.
Every team must have a leader, and in the ICU, the intensivist has the training and competence to lead the team. The intensivist, however, cannot provide all of the care for the patient alone. All of the team members are needed. The primary focus of a truly integrated team of dedicated experts is on the patient, not on the specific types of providers. The goal is safe, efficient, effective, patient-centered care. The integrated team of dedicated experts is the mechanism by which that goal, optimal patient outcomes, is most likely to be reached.
Since its inception in 1970, SCCM has endorsed this approach that incorporates an integrated team of dedicated experts to ensure excellence and consistency in the delivery of critical care services. To learn more about the Society of Critical Care Medicine, visit www.sccm.org.